devastating it is when you are undergoing a phenomena that does not exist anywhere else in the developed world: medical bankruptcy. The counter narratives are almost always like profit motive driven, unless you're like a right winger and you're just like start lying and say like, well, your taxes are going to be 90%, and also there's not going to be a doctor, and also they're going to kill you if you go to the hospital unless you're gay, and then if you're not gay, they're going to make you gay, they're going to sodomize you and then make you gay. Like, unless you just straight up make up examples, if you actually try to argue this from the perspective that like the Democratic Party tries to argue it on, it's almost always about the bottom line of like the pharmaceutical industry and private insurance. Absolutely zero people who are normal will give a about. They'd be like, what are you saying to me? The right-wing counter to this is just like, doctors will make you homosexual. The neoliberal right-wing counter against it is like, what about the profits of the shareholders?
Let's take a step further.
Okay.
Let me talk about the Canadian system. All right.
Okay.
Simple system. You pay taxes, and progressive. The more you make, the more you pay. But everyone pays taxes. All right. End result is you walk into the hospital, you sign your name, you get all the treatment you need. And it's good quality healthcare. You don't have to argue with insurance companies. You get the care that the doctors think you need. End of discussion.
What about the propaganda with Canada where you have to wait for a procedure? Great question. It is entirely due to right-wingers in Canada, both on the Liberal government and also the Conservatives, underfunding the social safety nets. Deliberately, mind you, so that people get resentment and develop resentment towards socialized medicine, with the direct goal of trying to privatize key aspects of the industry, which is already happening in certain parts of Canada too. Like, this is a deliberate method. You consistently underfund government-funded healthcare. It becomes unmanageable. People start dying. They develop resentment towards these institutions. They start saying, what the going on? Like, I can't get paid enough. Nurses and doctors are angry. They don't get paid enough. There's not enough staff on payroll on top of that. And then ultimately, the solution is privatization. They're doing this with the NHS. They're trying to do this with the NHS. They're trying to do this with socialized medicine in general. Also, waiting is not for immediate life-saving. Like, you don't go into the hospital emergency room with a gunshot wound and they go, oh, come back in 3 weeks. That's not how this goes. Wait lists are for procedures, oftentimes elective procedures, or rather procedures that are still life-saving. It's still life-saving procedures, but it's not like immediate. You know what I mean? Like getting a hip replacement. So the question at that point becomes, would you rather wait a month or two to get this hip replacement? Or would you rather be able to get the hip replacement, maybe, if you have enough to pay for it, and then have a lifetime of medical debt as a consequence of it? Try to 6 to 9 months. Like I said, the waitlist part of the equation absolutely has everything to do with underfunding. There is obviously a finite amount of time and resources that you can spend on this process. So if there's a finite amount of time and resources, there's an allocation of resources that occurs. In the United States of America, the allocation of resources is not distributed by need, who needs this immediately, but by who can pay for it. Dynamic under capitalism is that the wealthy person's cat takes first priority over a hungry human. If there's only 2 bags of food, the wealthy person can buy a bag of food for themselves and a bag of food for their cat before you get a bag of food at all. In a socialist distribution, obviously, cuts would need to be made if there was a, this is a reductive argument, but if there was a cut that needed to be made, both humans would get a bag of food instead of the cat. No disrespect to the cat lovers in the chat and dog lovers as well. It's just that, give the cat some of your food. You know what I'm saying? There's obviously also waitlisting in the United States of America as well. There's also another problem in the United States of America, which is lack of access to care at all in rural areas. Rural hospitals have shut down all around the country. Okay. As we were talking about yesterday, medevacs are becoming more and more commonplace, like helicoptering patients, which is insanely expensive. It's just really up. It's really bad. And the irony, of course, is that these kinds of anti-socialist, hyper-capitalist measures are first and foremost gutting and eviscerating and destroying rural areas, which happen to vote consistently anti-socialist and consistently Republican. Isn't that crazy? As material conditions worsen, you become more and more reactionary, and the conservatives fill that gap with, Mexicans are actually stealing your healthcare or whatever kind of narratives, and people tend to believe it. Look no further than West Virginia if you want to see how that works.
You want to hear something else crazy about the private insurance system? You work for a big corporation, okay? They give you good health insurance. He works for McDonald's. That's pretty crazy. Where you work determines the kind of healthcare you get. Anyhow, so we go from 65 down to 55, 55 next year down to 45, 45 to 35. Fourth year, you cover everybody. Absorption. So you have a Medicare system that covers all people.
This is so funny. People will go, there's no dental in Sweden. It's privatized. Bro, that doesn't mean it's a good thing. Wouldn't you want dental to also be covered? I'm a firm, committed believer that if the Democratic Party didn't get in the way of Bernie Sanders and there was like a Kamala Harris style situation that occurred this time around, but with Bernie Sanders in 2016, which obviously is laughable, it would never happen, we would have experienced 8 phenomenal years of prosperity.
Well, I mean, I think it could be that we're not taking as good care of ourselves.
Okay.
And I think it could be that, that we don't have as good a health care.
All right. I think that's 2 out of 3. All right. Now, here, there are 2 facts. Japan, other countries will live 4 or 5 years, 6 years longer than we do. That's a lot. You know what I mean?
Yeah.
So they'll live, I forgot what it is.
Like 8% or something.
Yeah, right. It's a lot. But here's another fact that is really unbelievable. It's not just that we live shorter lives despite spending so much on healthcare. The gap between the 1% and the working class is 10. If you're rich, you'll live as long as people in other countries. You have a long life, in the 80s or whatever it is. If you're working class, you're going to live 10 years younger. How does that happen, do you think?
Wow. Because just stress, burnout.
Stress, burnout, lack of access to medicine, terrible dietary habits as well, which is not influenced by individual responsibility at all, but instead lack of access to education surrounding food deserts, and also obviously work conditions that cause you not to be able to have your own, cook your own food or whatever, disability born out of your place of work that isn't properly protected due to lack of labor regulations, poor work conditions, lead in your water pipes, infrastructure. Lack of sleep is another major reason for why the life expectancy is much lower for working class Americans. There's a multitude of different reasons. It's just that all of them are bad. And it's sometimes things that you would not even consider to be a problem. I'll give you an example. Walkable cities. The American cities are designed around vehicles. American cities do not have an adequate public transit. When there's not enough adequate public transit, everybody is car reliant. Car reliant infrastructure is deadly because when there's no public transit, there's no reason to walk. When there's no reason to walk, you just drive everywhere. When you drive everywhere, you end up becoming fatter. It's that you would not even consider, that you would never even think that plays a significant role in Americans being massively obese. It also then contributes to air pollution. It contributes to car accidents. Car manufacturers make nice profits at the end of that bargain.
I know you guys had launched an investigation, even because this is kind of current, about Ozempic, right? And the cost of Ozempic in different countries. Because I was dating a girl, or not dating, but we met up a couple times at night or whatever. And it's like,
man, you're talking to Bernie Sanders, bro. Come on, dude. That's Bernard Sanders, dude. Yo, I'm hitting this, right? Hey, Bernie, I'm hitting this, right? This broad. We're dating, right? We was just talking.
They're going to have to come then and sit down and negotiate with Medicare price. That is, by the way, what the Veterans Administration does. The VA in America does a good job.
Yeah.
They don't pay outrageous prices. They negotiate, and that's what Medicare is beginning to do.
Yeah, if you can't breathe, I mean, yeah, you're almost a fish if you can't breathe, Let's talk about some politics. Oh wait, and the price transparency, that's happening now. Like people have to show their prices, or they don't.
No, they don't. We still haven't passed that bill.
Okay. Do you think it's going to happen?
It's a popular bill. I think we have a good shot to get it done.
Yeah, that's cool. Yeah, man, it makes me just sick because somebody's already sick.
Can you imagine if there was like one of the major parties running on this, dude? The only people I've ever encountered that are anti-Medicare for all are online. They're on Reddit. I've never in the real world, Trump Republican, MAGA conservative, liberal, whatever, I've never actually met a single person that's like, yeah, no, that would suck actually. It's so crazy. My boyfriend's parents think if you are unhealthy, it's your fault and they shouldn't have to pay for it. Let me guess, they're fat too, and most likely are going to die to heart disease and are already on their way to become diabetic. It's always the least healthy who are like, yo, you know what? If you are unhealthy, that's your goddamn problem.
Or just the current candidacy. I wanted in 2020, I believe that's when you ran. I wanted you and Donald Trump to be on the same ticket, right? That was a thought that.
Bro, Look at Bernie's face. Dude, Theo Vaughn, dude. He's so dumb. Oh my God. Hey, listen, God bless his soul, okay?